Lori Daniels. Thank you for having me today. I'll start with the title of my presentation. We're going to focus today on ways to improve self-efficacy in students with learning differences. Just to give you a little bit of background about myself, my studies involved cognitive psychology with an emphasis in perception and attention research. After getting my PhD, I went to universities and focused on developing programs that emphasized critical thinking in students and metacognition, which is essentially thinking about our own thinking. And I also had the opportunity to work at the university level to help develop programs that were really aimed to improve self-efficacy in students with learning differences. And I gained a lot of tips and techniques and just interesting firsthand experiences in working at the university level, though I do think a lot of what we're going to talk about today would apply even pre-university levels in high school, for instance, and just the importance of self-efficacy itself and what we can do as educators or parents to help improve this self-efficacy. So that's a little bit about me, and let's get started looking at what this topic is about and our approaches here. Okay, so their learning outcomes, or some of the purposes of this presentation, are going to be to look at discuss and define what is academic self-efficacy. We're also going to look at why is this important, right? So what is the importance of it, and how does academic self-efficacy impact behavior, right? And then we'll finish the presentation by looking at specific strategies that I said parents or educators and even students themselves can use to help improve their academic self-efficacy. All right, so the basis of academic and self-efficacy in general, which we'll look at, really comes from a theory in psychology called social cognitive theory. And this theory emphasizes the importance of our thinking and our thinking on behavior. Now, at this point, it may seem like that is kind of obvious, but historically in psychology, there was a lot of emphasis on just outcomes, right? Without really thinking about what went into those outcomes. And so when social cognitive theory came around, it was really revolutionary to start to put an emphasis or to highlight the impact someone's thoughts have on any given behavior that they do. Right. And so you'll see a lot of emphasis on this, and the power, it basically speaks to the power of our thoughts on determining our behavior, what we attempt to do, what we don't do, how we, of course, interpret or assess what's going on around us. And so it puts that focus beginning with the individual and any sort of thoughts or ideas that they have. Social cognitive theory also looks importantly at what we call patterns of thoughts. So it isn't just any random thought that someone might have, but if we're going to look at this from a scientific perspective, we have to look for patterns. And it turns out that these patterns are going to be what are so powerful or predictive in explaining people's behavior. Additionally, in order to be a good scientific theory, we have to be able to measure this somehow. And this may seem interesting at first, like how do you measure someone's thoughts, right? They're inside their head, but in theory, we could ask people through surveys and scales to see if we can pick up on those patterns. And that is, in a sense, then measuring their thoughts, right? And so, like I said, it's not going to be just any thought somebody has, but thoughts that are consistent, predictable, and probably most importantly, actually lead to or correlate with specific behaviors, okay? And so that's what I'm going to show you today is one way. There's a lot in social cognitive theory that tries to look at patterns of thinking, and we're going to emphasize today self-efficacy as a pattern of thinking and how we might measure that and what that might then mean for our lives and behaviors. All right, so self-efficacy is really the work, and social cognitive theory in general is really the work of Albert Bandura, who is now essentially famous in psychology for being one of the first people to reject the idea that just rewards and punishments are sufficient to explain people's behavior. So while rewards and punishments are useful and we definitely respond to them, his idea and his theory was that it's not sufficient, it's not enough. He says people are doing things regardless of the fact that perhaps they weren't rewarded for it in the past, or they were punished and they're acting in accordance with it anyway. And his idea was, well, this must be something to do with how they're assessing, viewing, thinking about the situation. And he also brought in the impact that just simply watching others would have on our behavior. So even if we are not directly rewarded or punished, we could observe someone else being for that same task and therefore act accordingly. That is, we're learning machines that could learn from our own direct experiences. Bandura, it has a lot of influence in psychology for those reasons, but I think one of the most interesting is his own life experience and how that led to him having an emphasis on learning in particular. And so one of the inputs that basically, helps with his theory, like I said, is his own experience and being born in Canada, in Alberta, Canada, and sort of a rugged area, not very, not a high population. He basically said his high school had 2 teachers. His whole entire high school had 2 instructors. And he said, what this led to, instead of being a detriment, he viewed this as a good thing in that it forced everybody to really take responsibility for their learning, become self-directed and self-regulated. And that you can see that kind of trickled down into a lot of his theories and his ideas that we're gonna talk about today. If I can, I don't always quote, but I think he has a quote that is very meaningful as far as this discussion goes. And it basically says, content, what we learn content-wise is perishable. Right? It could change over time. It could just simply go away over time. But the self-regulation skills that we learn have a long-lasting functional value regardless of whatever pursuit we might find, right? And so basically saying the emphasis is on skills rather than content. There's nothing wrong with content, but it's really just a piece of the puzzle, and it's the skills that transfer over. And you'll see this a lot in our discussion today, with an emphasis on focusing on skills rather than the content, rather than simply only the content. All right, so let's look at some of Bandura's social cognitive theory. As you can tell by the term, the name of it, there's a strong cognitive component where behavior is explained by expectations people might have, beliefs they have about themselves, beliefs they have about others, right? Comparisons they make to themselves and their past selves and other people, and of course judgments. So that all of that comprises the cognitive element of the theory. The social element then, as I kind of mentioned already, would be looking to others as models or as teachers to help guide us and help guide our own behavior. And he emphasized that this is a dynamic system, and that is, of course, the opposite of something static that you either just have or you don't. But he said instead, this is something that we essentially adapt over time based on our learning, based on our motivation. People regulate their own lives, right, based on what they're motivated to do, what they want to learn, and how they adapt to basically an ever-changing environment between their own expectations and other people, right? And you'll see this come up a lot in his theory about the dynamical aspect of it. And I'm emphasizing this dynamic system because if you have a system that can change, then there's ability to increase things, right? And that's sort of the idea today is, how do we go from this is where we're at to where we want to be? Well, you have to be in a system that is capable of change. And so the fact that his theory emphasizes this is really important, right? Right, so one of the aspects where you really see this dynamical interplay comes in his idea of triadic reciprocal causation. So that's a very fancy word for something that I think we experience a lot in life, right? Which is when you're looking at, or you want to really explain any given behavior. And I think we do this all the time when we say, oh, why did they do that? Or why did they keep doing that? Or, right, that's probably one of the biggest questions we ask about ourselves and others is the why question, right? Why would someone do this? Or why did I just do that? Bandura argued that it's not really that simple of an answer. You can't say, oh, you did this because of blank, right? You can't just throw in one answer in there and expect it to be right. Instead, he said, because we live in this sort of ever-changing world and ever-changing system, you have to know all the components, and the components feed back on each other, right? So it's not just that the person comes in and that's all there is. Instead, a person walks into an environment and changes that environment just by their mere presence, right? Just them being there would change the environment, and the environment can turn around and then change the person. So I always use this example of, you know, we're probably not the same person. We don't act the same way in, say, a library as we would a party, right? And that's because the environment itself is really confining our behavior. It's telling us that we should be quiet and reading versus that we could be talking to friends and having, you know, a more gregarious time. And that's the environment working on us, telling us how to be. Though nonetheless, a person doesn't necessarily change their traits. They don't suddenly become shy just because they're in a library, but they might just temper how they're acting, right, temporarily. And so you have this interaction where the person brings to the table everything, their goals, their expectations, their thoughts, essentially, their personality traits. Physical characteristics belong to the person. So someone's gender, their age, right? All of those come with them as they move into a certain environment. And then, like I said, the environment would act on them. This happens too with behavior, right? So we tend to think, well, people's behavior reflects who they are, and to some extent it does, but it turns out that that works both ways. So you may find that you've done something, right, the behavior, and then that changes how you view yourself, right? So even personality or the person and behavior go back and forth. It's not just the person directing behavior, but behavior can change, like I said, how you view yourself, for better or for worse, I guess. So all of these interact, and so it does two things. One, I think it makes, it fits more with what we know about the world, right? And so there is a common sense element to it. On the other hand, it does definitely make things more complicated, because there isn't going to be just one solution or just one reason why an individual is acting or feeling a certain way. We'd have to have the whole context and the history of said context. Now, in learning and education, I'm going to give you an example of how this can play a role for better or worse, right? So since we're in this constant interaction, we can start to set up cycles, sometimes even, I believe often unknowingly, we set up cycles which really start to self-perpetuate, right? So they become more and more of a pattern over time and become stronger and stronger. So let's take, for instance, a learning example where someone walks in and has a rather high expectation of success for themselves, right? So they say, I feel like I can do this, I'm going to do really well. And other people, the environment, notice that, right? They might notice, that's what people do, they notice that you're really trying, or you really believe in yourself. And so they deem that you are someone to invest effort in, and they begin to help you more. Now, because of that, you might end up with an outcome or behavioral outcome that you succeed, right? As what you really planned in the first place, right? I thought I was going to succeed. Other people saw that, helped me, and now I did, right, in the long run. But you can see how this could also work in a negative spiral too, where if someone walks in and does not believe in themselves, right, has rather low expectations for success, that other people, and these could be teachers, these could, right, they might say, well, they don't really think they can do it. I'm not sure that they can either, or that they're even willing to try, so I'm not going to put too much effort into this student. And then the outcome, of course, is that they're not successful. They fail the course, or they fail the test, etc. And so in that case, it's become, right, that self-fulfilling prophecy in a sense. And this is really speaks to the importance of that initial view that the person held, right? So the person who comes in and says, I can do this, has a different outcome than those that come in and say, I can't do this, right? And it turns out research does support this idea, where we see that something as simple as your confidence in math and your achievement in math tend to reciprocally go back and forth and influence each other. So those who walk in with a high confidence tend to actually do well. On the other hand, those who walk in with a low confidence tend to have lower levels of achievement. And it is this back and forth, so it's hard to say, you know, what comes first. Why would someone walk in with a low confidence in the first place? Probably because of their own previous history, right? You know, why would someone not believe in themselves? Maybe because the past has told them not to. And so it is, of course, we're not never starting from scratch. There's always a previous history. But what this demonstrates is how important those beliefs are on those outcomes. And that's really the story of our discussion today, is how important those beliefs are. So I want to take a moment to have you look at a survey. I mentioned earlier that cognitive psychology wants to do more than just say people have thoughts. They want to try to measure them in some way and see if people score higher or lower on these thoughts. And then if we can take those scores and see if they're meaningful in predicting behavior. So this is actually a sample. It's not the full one, but a sample of some of the questions that you might see on a academic self-efficacy scale here. And so it also gives you an idea of what academic self-efficacy is, because you can often tell by the questions being asked what that construct, what we're really measuring here. And the participant who would take this scale would basically just say whether they agreed or disagreed with this statement, the questions or the statements, I guess, on a scale of 1 to 5, with 1 being, I don't agree with this at all, this isn't me, this doesn't sound like me, to 5 being, yes, this is, very much sounds exactly like me. And so you can see what they are. I can learn what is being taught in the class this year, whether someone agreed or disagreed with that. Of course, that's before the class even begins, right? I can figure out anything if I try hard enough. If I practice every day, I could develop just about any skill. We're going to talk about that element in a little bit. Once I decided to accomplish something that's important to me, I keep trying to accomplish it, even if it's harder than I thought. So you see this an emphasis on effort, right? I am confident that I will achieve the goals I set for myself. When I'm struggling to accomplish something difficult, I focus on my progress instead of feeling discouraged. So an emotional component here, right? And I will succeed in whatever college major I choose. So these kind of set you up for an idea of what is trying to be measured, which includes an element of confidence and also some emotional elements, like what do I do when I feel frustrated? How much does effort play a role, right? Does it matter to me? Do I think my effort will pay off? And if you combine these, you get a score, essentially, that will tell you how much somebody ranges on this scale. So for instance, if someone went through and gave all 1s, right, they'd end up with you'd add them up, so you'd end up with a score of 7, and that would be probably very low, right? Because the highest you could get is someone going through and doing 5s here, so you get 35. So we have a scale of 7 to 35, at least based on this sample here, and people will score somewhere in between. So it's probably very uncommon to get someone who has the lowest score and also the highest score. So people might, if they're taking it fairly, they wouldn't go through and put all 1s or all 5s. They would actually think about each one and put a number. And so we actually do get a pretty decent range of responses. And then the idea is, does those range of responses actually lead to behavior? Now, this measurement tool that we're looking at is something that samples, it's not the full one, but it samples what we call academic self-efficacy. So to define what self-efficacy is, there's a kind of fancy definition here, but a lot of times I think there's an intuition about what it is. Bandura says, this is his definition, that it's an individual's belief in their abilities to exercise some measure of control over their own functioning and environmental events, right? So notice he says some measure of control, because obviously there is an indication that there are some things that are kind of beyond our control, right? The weather, right, wouldn't be something we could control. But it's really about how much does what I do matter, right? How much influence can I have? And so that's why I say there is a range of scores that people might have here. And self-efficacy can be considered global. That is, it can relate to just in general how much I believe I can control what's going on around me, right? But also, and in practice, it tends to be used more specifically. So for instance, this scale just looks at academic self-efficacy rather than self-efficacy for, say, driving, right? You could have self-efficacy for anything. Self-efficacy also, just as a distinguishing factor here, it is correlated with a lot of other things that we think of, like confidence and self-esteem, but it is not quite self-esteem or confidence by themselves. So for instance, looking at self-esteem, I may have low self-efficacy for something like drawing, right? I don't believe in my ability to draw very well, right? But that may not affect how I feel about myself in general. Maybe I don't care, right? So it may not bother me. Certainly there are things that we're good and better at and that don't really have a big impact on how we feel about ourselves. So it's not quite the same as just feeling good about yourself. And it's not quite the same as just being confident, though confidence is linked to it. Part of the reason is that one could be very confident that they're going to do poorly. So Bandura argued that confidence doesn't really tell you which direction, right? Whether you're looking for a positive or negative outcome. I would be very confident that I could not paint the same way as a professional artist. But instead he said confidence is a little too vague, and self-efficacy is just more specific about a belief in your abilities, right? Okay, so now we have the definition of self-efficacy, which is this belief in our abilities, specifically in this case, a belief in our abilities academically for learning. Why is academic self-efficacy so important, right? Why spend time looking at it and thinking about it? And it turns out self-efficacy is very important, super important. It's been found research-wise to be one of the determining factors. I'm going to show you almost how shockingly important it is, I think. So more important even than people's actual ability level, which is, for me, is really like the take-home message. It's, you think, well, this is what people can do. And Bandura said, no, this is what people think they can do, which may or may not actually link to what they can do. And that's very important piece here. So academic self-efficacy influences what we even choose to do in the first place. And this is part of that self-perpetuating cycle. So we have these expectations, whether I'm going to succeed or fail, even before I try something, right? Usually because of our own past history. And so I kind of walk in knowing how I'm going to do, quote, right? Knowing. And therefore, I'm going to make choices that are based on my expectations. Why would I choose to do something, in a sense, if I didn't think I was going to do very well, right? So to give you an academic example, I might not study if I didn't think studying really mattered. If I believed that there was nothing I could do to improve my scores on a math test, I wouldn't study for that math test, right? Or if I didn't believe that homework or practice was going to help me, well, then I wouldn't spend too much time, if I did any at all, on that said homework, right? So same thing for seeking help. Why would I seek help if I didn't believe that it would matter? And of course, then I'm going to probably, motivation-wise, I'm probably going to avoid anything that I think is difficult or that I'm going to inevitably fail at, right? And so this component of self-efficacy, choosing what we do in the first place, is a very strong component, as you can imagine. The goals we set for ourselves, whether they're high or low or somewhere in between, is directly based on whether we think we can attain them. Whether we have emotions based like on a fear of failure, probably have to do with our past history of failing, and whether we use strategies, which is going to turn out to be a big component of how to help with self-efficacy. Whether we choose to use them in the first place is really determined on whether we think they will work, right? So again, the power of our original thoughts determines what we do in the first place. Even if we decide, though, to do something, maybe we feel we're a little forced, I have to study, I have to, right? It turns out the amount of effort that we put in is going to be determined, again, by our self-efficacy. So how long I study, even if I've decided to try it, how long I study or how much I persist with a difficult task is going to be based on whether I think I can do it in the long run. The self-perpetuating cycle comes into, it really becomes obvious here with the idea that if I put in low effort because I think I'm going to fail, I end up probably failing anyway because of the low effort I put in. So it's tied to something that we call attribution theory, to attribute the reason. So perhaps if I put in low effort, I see it as proof that I wasn't good at it, and therefore I shouldn't have put in any effort anyway. And so I'm attributing my failure here not to the fact that I didn't try, but that I'm not my ability. I wasn't able to do it no matter what. And so we sort of end up using these, there are explanations about why something happened, and we don't put in a lot of effort because we don't think we will succeed, and then we don't succeed, and it's sort of proof, right? See, I knew it, And to be fair, this works, I think, on all of us. If you really didn't believe that you were going to do well at something, you're probably not going to put a lot of time or effort into it, right? Because it just feels like a waste of time. And so obviously it's more that initial belief that's really working against us here. And inevitably, when we do have successes or failures, resiliency is another component here, that how much we come back from and what we attribute failure to, right? So why would I bounce back and try again after I failed if I believe that that's a product of my ability rather than a product of effort or strategy use, for instance, right? So handling setbacks, our overall resiliency on a task, if our self-efficacy is high, we'll see that as just a temporary hurdle. Okay, I can do better. Versus if our self-efficacy is low, we might say, see, I knew it, I told you I couldn't do it, and here I couldn't do it, I'm not going to try anymore, I'm done, right? And so we have pretty low resiliency for that given task. Now, the thing is, self-efficacy is super important and even more important than someone's actual ability level. So self-efficacy has been linked to positive outcomes across all grades and all content domains, which means regardless of whether it's math or writing, public speaking, or right, no matter what the actual academic portion of it, self-efficacy turns out to be highly correlated with how people do. Now you might be thinking, well, of course, because if I have a higher ability, of course I'm going to feel like I can do better, and therefore I do. So this is really just about ability levels and not about my beliefs. And it turns out that's not true. Even if we take into account ability level. So if we take everyone with the same ability level and then measure their self-efficacy separately from that, right? And we said how you believe, what you believe about yourself may not actually link to your ability levels. They're not necessarily the same thing. It's a belief. It's not what's really going on all the time. So even when students with the same ability in math, in this example, were, in this research, were compared, the ones who had the higher self-efficacy performed better. So keep in mind what this is saying is that everybody had the same ability, they were equal, that they were tested on ability and were equal, but when given a test later, the ones that had the higher self-efficacy actually performed better. So it's not really about the ability level itself. Of course, that does matter, but that's not quite what's going on here, because we can control for that and see that self-efficacy still has an impact above and beyond someone's actual ability level. So it shows you just how powerful academic self-efficacy, in this case, academic self-efficacy is on outcomes. All right, so let's look at what factors impact someone's self-efficacy. And part of the reason of looking at this is because we're going to link it later to what we can do to increase it. So if we know what goes into it, what impacts it, then we can know how to help if somebody has low self-efficacy for a task. The biggest one then that impacts self-efficacy is what Bandura called mastery experiences. So mastery experiences really are our previous experiences of success and failure. It's what we know to be true about ourselves, right? And we all have this, I think, for some domain, some area where we might say, I've already said, you know, I'm bad at drawing, I'm not a good artist, I'm bad at painting, right? So we do talk in these terms. So we might say, I'm bad at math, I'm a horrible writer. And this comes from, you'd say, well, why would you know that? Or why do you think that? Well, and I would say, I think that because in the past, I haven't done very well, right? So what we're relying on here is our own previous experiences to determine what we can currently do. There's a couple issues with this that we'll look at. The first is depending on how strongly you believe that that your previous experiences determine your current abilities, can reflect really your mindset on what it means to have an ability and whether abilities can grow or not. So if you have what's called a fixed mindset, that means you believe essentially that you were born with X amount of abilities in various areas, of course, and then that's it. No, that's just the way they are. So if you're lucky enough to be born really good at math, you know, good for you. If you weren't, oh well. And there isn't much you can do to move that because it's either genetic or it's just the way it is, right? On the opposite, on the other hand, a growth mindset is where people say, you know, I may not currently be very good at this, but it's probably because I don't practice it enough. And it turns out that whether one of these are true or not, right, whether we are you know, just born with certain abilities and that's it, or versus the fact that practice helps, it doesn't really matter, but someone's belief in it matters. So and here's why, because if someone believes that they can get better, they will practice, right? Like we said, why would you bother if it didn't matter? So you start to practice, and with practice, you inevitably do get better. And because of that, having that growth mindset is really key to whether people view their abilities as something that they can change and therefore do change them, or don't, right? And so our own previous history determines how we view ourselves, but whether we think we can change them or not is probably more important. Another aspect that impacts self-efficacy, it turns out to be other people. So remember, Bandura's theory has a lot to do with that social aspect as much as the cognitive aspect. And so social modeling, Bandura emphasizes really watching other people complete or fail a task. And it turns out that one, we want to observe or pay attention to people who we think are competent or powerful or prestigious, enthusiastic, right? They grab our attention. A lot of celebrities do this, right? Whether they mean to or not, because they grab our attention. And in some ways, we'd like to imitate them. Now, particularly, this tends to have an effect on self-efficacy if we think the model is similar to us in some way that we want to imitate. So if I believe I'm a good singer, I might want to imitate a famous singer. If I don't, right, if I don't believe I'm very good at it, then it would just be like watching an Olympian. You would say, well, that's great, good for them, but there's no way I can do it. So social modeling has its biggest impact in, I think, what would be considered a peer setting. So peers that you think are similar to you, because if they can do it, so can you, right? Another element is social persuasion. So the important property here of social persuasion, which is really encouragement that we can complete a task, is that it's probably not going to create self-efficacy out of nowhere. So if I truly don't believe I can do something, someone simply telling me I can is probably not going to be good enough. So it's not a huge factor, but it may be a factor and leading to a temporary boost where we make a second effort. So imagine I'm thinking of basketball here, so I shoot a basket and I miss, and someone says, oh, you were really close, you just have to move a little to the left or something. And then because and I know you can do it, so because they persuaded me, I try again, or I try again doing something slightly different. So it does matter, right? Other people persuading us does matter, but it probably matters, you know, in those moments where we're not sure whether we would continue with the task or not. It also has the biggest influence when it comes from what the individual deems as a credible source. So again, their own perspective of who is credible or who is in a position to persuade them is really important. We won't just take persuasion from anyone. It has to be someone that we believe is in a position to know that we can do it again, right? So maybe a teacher would be a good one, or a parent, friends, right? Also our physical and emotional states, right? So our current mood can influence how we feel. This could be temporary, right? Our moods and our physical needs, being tired, being hungry, changes. But what could end up happening is that it becomes associated with a task. So for instance, doing math homework often leads to frustration. So over time, just thinking about my math homework might lead me to have these negative emotional reactions, or having anxiety during a test, for instance. And of course, this is going to influence our belief in our ability to do the test, or to successfully pass the test if we're too anxious or too frustrated to do the task. All right, so let's focus now on ways that we can increase self-efficacy now that we've seen what impacts it. And that's really the goal here, is that if we know what influences self-efficacy, then the way to increase it would be to go in and look at each of those elements and say, okay, what can we do for each of these to increase, right? That's what we're gonna look at now. The biggest one is to address those mastery experiences. So remember, we said these are our own previous history, and if you have low self-efficacy for something, then your previous history tells you you're not going to do very well on it. So we have to change that. And it turns out, it's like, I call this seeing is believing, right? Which is the way to change it is to get new experiences which are successful. So you're trying to basically build a bank of, okay, see, I could do it. I thought I couldn't. I didn't in the past, but now I am. And so how you could do that is, one, to create these successful experiences very slowly, right? And also to increasingly add to them, to the challenge. So here I have an example of public speaking. You might first, you know, just join in a class discussion once a week, and then the following week you go up to 3 times. Then maybe you're going to tell yourself, I'm going to do it every day, right? And so the end goal is to give this speech at a school meeting at the end of the year, and you can imagine anytime we have a goal like that, that's kind of big, we might think there's no way I can do it, there's no way I can do that, I'm going to fail, I'm not going to do well, I'm going to be too anxious. And it's really about breaking down that end goal into these series where you say, okay, what can you do? And okay, I can start with this. And so you're just essentially building those successful experiences. I found with working with students who had learning disabilities, this is one of the biggest challenges, was, I would say convincing, socially persuading them that these small goals were helpful. They are, but sometimes it can be hard to take that first initiative. So I would have students that, you know, came to me and said, I failed math. Now, you say, oh, that's not good, except they didn't even go to the math class yet. This was day one, and they've already telling me with 100% certainty that they have failed this course. And I was like, well, you haven't even gone yet. You know, the class starts next week. How do you know you failed? And of course they said, because I've failed every time I've tried. And so they truly and completely believe that they are going to fail. And one of the things we'd say is, okay, stop thinking about whether that end, right? That end goal is, you know, at the end of the semester, what is that letter grade on my report card? Let's not think about that, you know, because in a sense, they've already given themselves the F. So they say, let's not think about that. Let's go back. What can we do this week to make an improvement? And for sometimes it was, okay, I will try my homework. You know, it can be really small steps, but if they try their homework, I said, let's try your homework and see if you can get half of them right, you know, like, and if you can get half of them right, next week we could see if we can get 70% of them right. So you can, you know, you don't have to be looking at that, you know, final grade right away. And this is a big thing. People who don't do well or have failed something tend to go straight to that end goal rather than seeing the steps along the way. Another big component we can do to increase self-efficacy, because it's a belief in your abilities, you have to increase the ability, right? And in order to increase the ability, we have to learn strategies. We have to learn the how, right? So one, we have to take ownership. We have to take that control back. I can learn this, but this is what I'm going to do it. Rather than a grade is going to magically appear on my report card, instead we'd focus on, okay, how can I learn to do this particular skill? Learning strategies are huge, right? So for instance, a lot of times people say, I just sit down and study. And I say, well, what does that mean? You know, how do you study? And the answer is, I don't know, right? I just sit and read and read and read, which is not really a strategy, or it's not a good strategy. So instead say, well, what if you made flashcards? What if you tested yourself? What if we did this, right? So coming up with those strategies, which really focus on the how of learning, and be very concrete or explicit about, this is what I'm doing, because that gives you the confidence. You're not just like, I'm not sure what I'm doing, I hope this works. Instead you're saying, I'm doing this. If it doesn't work, so you monitor it. If it's not working, I'm gonna find out why, and I'm gonna change it a little bit. You know, maybe I'm making flashcards, but I'm putting too much on them, right? So, okay, I'm gonna scale back and put a little bit less on, or I'm gonna test myself more. And then setting those, like I said, realistic learning goals. So even if you want to, like I've had students who have very severe dyslexia and say, you know, this is the college level, I have to read a 30-page paper by the end of the week. You know, in my English comp, it's a story, there's no way I can do it. It's Freud's interpretation of dreams. It's a 30-page excerpt, I can't read it. And I say, okay, so maybe that's not realistic for you right now, but what is realistic? What could you do to get, you know, have an understanding of what this assignment is about? And so oftentimes we'd start by just kind of, well, let's look up Freud, let's see, you know, and then when you go to read it, you have more context. And you say, oh yeah, that's right, we talked about this, and now I see it here, I can understand it more. So, you know, applying those strategies, being realistic in what you can and can't do. Ultimately, self-efficacy will not go up unless the success that the individual has, they attribute to their own ability, their own effort, their own strategies, their own choices. If other people simply do it for them, or they simply think, geez, I lucked out, the teacher happened to grade me easy today, then that doesn't actually increase their self-efficacy. So they need to be very explicit about what they're doing and really monitor whether it's working, whether they're actually learning and getting better at it realistically. That will increase self-efficacy. Another strategy is to recognize and reduce avoidance behaviors, often like that emotional component when there's something we don't want to do, right? We don't do it. So to notice when you're doing that. A lot of cognitive psychology focuses on just awareness, right? So notice like, hey, I'm saying I'm bad at this, that's criticism. I'm shopping when I should be here watching TV, when I should be studying. Time management, holding yourself to a strict schedule so you can't escape these behaviors. Obviously, some behaviors are very detrimental, like abusing alcohol or drugs, taking out unpleasant feelings on others. So just really recognizing behavioral patterns and stopping them. Also noticing how you talk to yourself, right? So saying, I'm not good at this, like I'm going to fail, I'm bad, labels like I'm stupid, or, they have an impact. Even when people are joking, they tend to have an impact on how you view yourself and the task that you're setting out to do. So one is, again, to monitor, like if you catch yourself, or the student, catches themselves saying these things, is to really ask them to stop that and then reframe it. Like, well, what do you really mean? And we all have sort of automatic thoughts, but challenging those thoughts is important. In cognitive psychology, a part of therapy is what we call reframing. And reframing is based on the idea that a lot of our emotional feelings can change depending on how we think of them. So take surprise versus, or excitement versus fear. Now, your body reacts in very similar ways. You have increased heart rate, increased respiration, but it's really the label you put on it. When you say, I'm afraid, I can't do this, or I'm happy, or this is fun, or I'm excited, that really changes how you behave towards that, whether it cripples you in a sense or whether it pushes you forward. So one of the things we do is take those, the feeling is still going to be there, right? The emotion is still going to be there, but how you interpret that emotion is very powerful. So saying this is a challenge when something is difficult means you can go forward, versus saying this is impossible means you can't do anything about it, right? And just in general, looking for ways to use those, affirmations, and to, address the emotional component of learning, which is really a very strong component, and in that it influences, right, as I said, how we even view effort and resiliency. Another very important element is responding to feedback, and in the effort of time, I can't go into this too much, but the stories I have about feedback, I would say this is a huge indication about how people respond to feedback. Nobody likes criticism, right? Of course, it's not something fun. But feedback, if you view it as this is what you did wrong, it can be debilitating. It can stop you from moving forward. But if you look at it as, okay, these are the things I can improve upon, right? Then it actually would be, it teaches you how to improve those skills, and therefore to improve your self-efficacy. So, notice how you're interpreting feedback. I have a lot of students, I have this talk with them all the time about feedback, because, I get feedback too, we all do, and I say, listen, if feedback doesn't necessarily mean that everything you did was wrong, which is one common thing I find. Everything I did is wrong. It's like, no, it's not everything. Negative feedback doesn't mean you're a horrible person, doesn't mean you can't do it, doesn't mean, right? All it means is that you put something out there, and this is how it was perceived. It may not have been perceived the way you wanted it to be perceived. It may not have been accurate if it's a math test, like it's not, it just doesn't fit what you thought. But we don't know until someone tells us that it didn't fit, right? And so it's very valuable to take how other people are viewing something so that we can change it and we can make it fit, make our message a little bit stronger, a little bit better, or in the case of some academics, just a little bit more accurate, right? And so feedback is the key to learning, and we have to change how we view it as almost like a thank you for letting me know, rather than, oh, I hate this, it's all red pen, right? I know that's difficult to do, but I think if you change your mindset on, or a student changes their mindset on feedback to be very important, that without it, they can't get better, they'll find it's very helpful in increasing their abilities. Another thing we look for is to gain that self-regulation and become an advocate for yourself. one of the things we find a lot, students who have learning disabilities, is that they feel like, you know, there isn't much I can do, this is just the way it is. But that's not true, right? There are resources, there are accommodations that are available, there are things they can do to put their best foot forward. And the more they use them, the more they become responsible for their learning, the more they will learn, in a sense, right? So becoming a strong advocate for yourself, even if that means, hey, I got this feedback, I don't understand it, I'm gonna go ask, you know, I'm gonna go find out. You know, it can be small things, but they're very meaningful. Don't just take, you know, a failure as a failure. Instead, see what you could do better, right? What did I do wrong? What can I do better? And look for any resource possible to help, right? The utilize resources, anything. Is there a writing center? Use it. Is there a study group? Go to it, right? You know, whatever it is. And speaking of, that also falls in line with our exposure to social modeling and persuasion as components, which is to join those peer mentor groups, because these can become your social models. They can also become great advocates for persuasion, right? You can do it. You see them doing it, you know, then you know you can do it too. So what you want in social persuasion, what you want in these peer groups, is something that highlights these successes, but also helps to identify your goals and really ultimately focus on the impact of effort, right? Okay, you tried, this is what happened, let's try this again, let's try this differently. Talking about, honestly, about things that didn't work, right? Just as much as things that do work. And really, again, getting that ownership of learning. You know, becoming a self-regulated learner, assessing along the way, what am I understanding, what am I not understanding, and then doing something about it, not just saying, well, I don't understand this, so I'm just going to walk into the test not understanding anything, but having put steps in place to solve that as you noticed when you were studying or the week before, right? Like, so that way you become more powerful in your own learning, right? More of an independent learner, and encouraging that use. Since we're getting right on time here. In summary then, academic self-efficacy is, you know, research has shown us it's one of the most consistent predictors. It's not the only, but it's one of the most consistent predictors of our academic achievement. I think you can see why it would be such a consistent predictor. And then focus on increasing overall self-efficacy does increase when students adopt those short-term goals and they gauge their progress towards an end goal, right? They use their specific learning strategies, so it's not just up to luck or chance or fate whether they do well, but there's actually a how behind what they're doing, right? Whether it be study skills, writing skills, math, whatever it is, there are strategies behind learning anything. And they experience rewards that are actually based on achievement itself, right? And that way they know that their effort is their own and their outcomes are their own. They're solely responsible for them. All right. I think that, okay. So question and answer.
Thank you so much, Dr. Daniels. I don't think we have any questions at this time, but if you would like to ask any questions, now's a great time to do so.